Real news for Americans 50 plus. This is Emeritus News Channel.
As all of you know, H1N1 is more than just a significant health issue. It has the potential to affect virtually every aspect of our lives, from our economy to national security to our educational system. As such, it will take Americans from every walk of life, all of us, pulling together and doing our part to mount an effective response. As I've traveled the country the last few months, I've learned that businesses across the country, from mom and pop businesses on Main Street to Fortune 500, are counting on the federal government to convey accurate, reasoned information in a timely way. We already face much economic uncertainty. A flu outbreak is a very scary prospect, and President Obama has mobilized the entire federal government to get America prepared. And the interagency effort you see here is further evidence of that cooperation. But government can't do it alone. For this effort to be successful, we need the business community to do its part. Businesses play a key role in protecting employees' health and safety, as well as limiting the negative impact to the economy and society, whether in regular flu season or during an outbreak of the H1N1. Here's what businesses can do to help. First, they can set the right tone within their companies. That starts with letting their employees know that if the employees exhibit flu-like symptoms, they shouldn't come to work. And if an employee shows symptoms during the workday, the CDC recommends that that employee be asked to go home. In America, we love to praise the Puritan work ethic, and with reason. But this fall, it would serve the country better to praise common sense and responsibility. From top to bottom, businesses need to drive home the point that if an employee stays home sick, it's not only the best thing for that employee's health, but also for the health of his or her coworkers and the productivity of the company. Second, employers will be able to develop smarter health policies for their employees by staying in touch with their local health departments and aligning their guidelines accordingly. That could mean anything from the basics, encouraging employees to frequently wash their hands, to covering their mouths when they cough and sneeze, to considering alternative work environments for employees at higher risk for complications from the H1N1 flu. Developing sick leave policies that are flexible and non-punitive also makes sense. You know, some businesses now require workers to provide doctor's notes or other paperwork to prove that they or their loved ones had to miss work because of illness. That's a requirement that employers should consider dropping. It has the potential to overload the healthcare system that will likely be stressed during this year's flu season. The third thing that is absolutely essential for American businesses is thorough preparation. Even if precautions are taken, some employees will likely get sick, and parents may have to stay home with a sick child or even healthy children if a particular school is closed down. That's why companies need to plan for continuity of operations with a depleted workforce. Plans should be put in place now to allow for teleworking and staggered shifts. Employees should be cross-trained to cover essential functions. And if the flu outbreak becomes severe, companies may need to take steps to reduce face-to-face meetings or to curtail non-essential travel to reduce the possibility of H1N1 flu transmission. Hopefully, companies never have to take these steps. But a little planning now will help ensure that our economy withstands whatever the H1N1 virus throws us this fall. And if companies need more information on how to prepare, they can go to the federal website, www.flu.gov. That's flu.gov to get a toolkit on how to prepare and plan for and prevent an outbreak of the H1N1 virus from drastically affecting your business operations?
Certainly, before vaccine is available, before vaccine becomes ready to go, there are a couple of steps that are critically important. One is encouraging target populations to get their seasonal flu shot. Seasonal flu vaccine will be ready. It's ready in some places right now. It's certainly going to be widely available in September, so encouraging employees to get that shot and get it out of the way is a good first step. As Secretary Locke has already said, the two best mitigation strategies really involve hands and home. So keeping your hands clean, which is frequent hand washing, frequent use of hand sanitizer, but also covering sneezes or coughs with a sleeve or an elbow, not your hand. So hand cleanliness, we know, will stop transmission of germs, and go home or stay home is the other critical piece of this puzzle, because we know that those are two important ways to stop the transmission of the virus. Now, vaccine, we know, is one of the best strategies to immunize the population against this brand new flu strain. So getting employees prepared to receive a vaccine is important. The target population has been identified, and we hope that employers do some personal outreach to the target population who may be in their employment. Pregnant women are particularly susceptible to the H1N1 virus and should be strongly encouraged to be ready to get a vaccination once it becomes available. Adults under 65 who have an underlying health condition, asthma, any kind of respiratory distress, are in the target population that we want to make sure are ready to be vaccinated. And if employers have younger workers, the target population includes those who are 6 months up to age 24. I'm hoping that no one has children working in their shops on a regular basis, but certainly the 16 to 24-year-olds who may be working full-time or part-time are a target population. And again, I think employers can go a long way to encourage those folks to get vaccinated. Healthcare workers are a critical target population, and a lot of the private sector employers deal with healthcare workers either on a full-time or part-time basis. And parents or guardians of infants under 6 months old. Vaccination is not recommended for babies, but keeping parents or guardians, grandparents, foster parents of those kids vaccinated will help protect the babies. So having the employers assist us in getting the message out to those critical populations so that they're ready to get vaccinated. We are working with 5 different manufacturers. They are preparing, as we said, for a target date of about mid-October for the production lines to begin. We never anticipated that all the vaccine would be available day one. It will be on a rollout basis, but I'd like to call on the Admiral to give you a very specific update on the vaccine.
There are efforts underway as we speak to increase the number of doses that are available to address this situation. But I think the one thing that we ought to expect is as this process goes forward, there are going to be fluctuations in those numbers. In terms of the sort of impact on the date that vaccine will be available, there are only so many people that you can vaccinate at once. So I think that as we go forward, the total number of doses is going to be the same, and there may not be any difference at all in terms of the actual number of people that could be vaccinated in those first weeks in October.